how do we treat facet disease? Well, let's be clear. First of all, arthritis is really not curable. People go, "Oh, can I get rid of this, cure my arthritis?" And I say, well, so far, no. We can treat it. I mean, so what is the difference between curing it and treating it? When I say treating it, I would venture to say that almost everybody over the age of 40 is going to start getting arthritis in the spine. And the reason we don't know it is because either it's not bothering us or because it has not been demonstrated on an MRI. And when do we get MRIs? When it does bother us, or we have an accident and we have a look, and that's when we see the arthritis and people go, "Oh my God, what happened? I have arthritis." Well, yeah, that's been there for a while. So how do we help with the arthritis pain? In the past, we used to just say, well, like a knee joint, inject into the joint. Arthritis on the spine, we're just injecting into that. But that's fallen out of favor. Instead, what we do is a very, very clever procedure. So what we're going to do is the medial branches are these little nerves that we're going to go after. Now, you can't see the nerves when you look at them under the X-ray or anything, but we know where they are, okay? And they sit in this little groove right here and right here. We know where those nerves are. They might be a little bit moved a millimeter here or there, but we know where those nerves are. And knowing your anatomy is half the battle to getting to this block. Anyone's ever been to a dentist, when they get a little injection here and it numbs out all the teeth and they can work on it, well, that's a block. I mean, we're just basically blocking pain impulses from the nerve. How do we do that? Well, usually it's lidocaine or some other local anesthetic. So what we would do is we'd say, okay, we want to put our block right here, because if the block works and the pain is less right afterwards, there you go, we were in the right spot. If we do the block and patient says, "Hey, doc, I didn't do anything. My pain is exactly the same." Well, then it helps us also, because we know that it may not be facet arthropathy or facet disease. So the block is diagnostic, and it can also be therapeutic, because what we can do is we can put a tiny bit of steroid onto this nerve as well as part of the block, and that, if that nerve is inflamed, that steroid can also help reduce some of that pain, and it may last a long time. So we'll get into how we do the procedure and how we do the block a little later, but the important thing to understand is the block is part diagnostic, part therapeutic. The diagnostic part is a little more heavy. So as any carpenter would tell you, before you cut a piece of wood, measure it once, check it again, measure it twice. And that's what we do with the blocks. We'll do one block and we'll say, okay, we'll have you move in a way, and we'll demonstrate that later, so that it hurts. And then we get a response from the patient saying, "Hey, this actually feels great. Oh my God, I wish it would be like that." And often our improvement is 70, 80, sometimes 90% relief. And if we get that, we say, great, we write that down and say the patient had a successful medial branch block with pain relief immediately after the procedure of 70, 80, 90, 100%, if that happens. We send them home. You go home, I see you back in about a week or 2 weeks, and I say, okay, how do you feel now? Oh, you know what? That block was amazing. That day was great. Maybe even the next day was great, but now the pain is back. What am I going to do? Don't worry, that's actually good news, because that tells me that the block was successful. What we do when that happens, we do round 2, or the second medial branch block. The same way, I may mix up the meds a little bit more, and I won't tell you how or what I did, but it gives me some more information. We do that procedure again, so it's the second medial branch block. After that medial branch block, the same thing. Hey, how do you feel? Right after the procedure, wow, this is great. I hope it lasts. I hope so too, but let's see. We bring you back again after a week or 2. You've had 2 blocks. The second one was about a week or 2 ago. How do you feel? I love it when the block is there working on the same day, but darn it, the pain keeps coming back, doc. What am I going to do? Well, it's good news, because now we have verified twice that putting the local anesthetic here on your nerve and having you tested by moving in such a way that it rubs something that hurt you before. And now we've been able to block that, and we say, yes, you are ready for the next step. And that next step is really what all of this is about. And that's called radiofrequency lesioning. Well, what is radiofrequency lesioning? Some people say, oh my God, it's like burning a nerve. It's not burning a nerve. That sounds a little horrific. Radiofrequency lesioning is actually a very gentle procedure. If you notice, we have this is a Nimbus radiofrequency needle. It's coated, it's rubberized all the way down so that it doesn't transmit any energy to the skin. And if you notice, just the tip is exposed. So what we would do is we would send a current through here, and I'll demonstrate the properties of this particular needle a little more later. But in general, the radiofrequency needles are rubber coated, including the Nimbus needle, and the tip is exposed. This one happens to be 5 millimeters exposed tip. This is placed on that nerve. Now remember, we went to these grooves, right? So we're going to place this right where that nerve is, and we develop what's called a lesion. What is a lesion? A lesion is just an area of sort of like chaos and destruction, okay? And we want that because we want to stop that nerve from sending signals from that painful area back to your spine and then onto your brain. So we want to stop that. I guess the best analogy would be similar to our dental analogy. Oh my God, my tooth hurts here. We're going to put a block here. Typically local anesthetic, but if we had to make it longer, imagine we could just, interrupt that nerve completely. Now people always ask, what, you're gonna radio frequency my nerve? I mean, can I walk? These nerves have nothing to do with the way that you move. Those are much bigger nerves. If you look at our model, here is our yellow nerves here. Those are the big nerves that control motion. These nerves, all they do is they tell us that the facet joint hurts. Okay, thank you very much, body. You told us the facet joint works. It hurts. That's fine. I don't need your input anymore, please. So that's why we radio frequency those nerves. And when we do that, the nerve, imagine the nerve to be kind of like an electrical wire, a copper wire. The outside has a rubber sheath, and the inside is the wire which is helping to conduct the signals. When we do a radio frequency lesioning, what we end up doing is we end up preserving the outside rubber sheath, but the inside copper part, it just kind of disintegrates. And it disintegrates, the body absorbs it disintegrates all the way back to the spine from the nerve that it came from, the body of the nerve. As it disintegrates, it grows back, just like you're growing your hair back. But guess what? It takes about a year, in most cases, for it to grow back. And in that year, a lot can happen. Anyone who's moved out of a neighborhood and gone back a year later, now, wow, my old hood looks better. There's a Starbucks, there's a Whole Foods, there's whatever. I'm not product placing any of this, but there's whatever. All this stuff that you expect in these trendy neighborhoods to come back. And you might say, you know what? The nerve grows back and it says, guess what? Hello, brain. Nothing to report here. Everything's fine. No pain. That happens all the time. Other times, the nerve may grow back and say, you know what? It still hurts there. Still some problems. We can do another radio frequency, and it's quite safe. So, just to recap, we do a medial branch block, test it again to make sure, followed by a radio frequency lesioning, and we'll get into that in a little bit, and that should help take the pain away. Okay.